Welcome to a new episode of Medicine in 3 minutes. As usual, we go straight to the point. The subject is bravely made clear and often illustrated. Let's start. Today's presentation is about autism spectrum disorder versus Asperger syndrome. Here's the plan of the presentation. The spectrum of autism, definition, prevalence, cause, symptom, language and communication, social communication, odd preoccupation, mental retardation, physical examination, evolution, and treatment. The second chapter is about Asperger's syndrome. What is the high-level autism? What makes the difference between autism spectrum and Asperger syndrome? And how to distinguish autism from a normal individual. What is autism? Autism is a development disorder characterized by difficulty with social interaction and communication, and by restricted and repetitive behavior. This is the spectrum of autism. It interferes with social interaction, social communication, and social imagination. Prevalence is about 0.04% of the general population. It occurred at 5/1 male to female ratio. Onset, it starts before the 3 years of age. The cause of autism is unknown. There is many hypotheses like encephalitis, vaccination, PKU. In early life, there are several prenatal and perinatal complications have been reported as possible risk factors for autism. These risk factors include maternal gestational diabetes, maternal and paternal age over 30, bleeding after first trimester, a use of prescription medication like valproate during pregnancy. Low vitamin D level in early development has been hypothesized as a risk factor for autism. Social symptoms include lack of peer relationship, failure to use nonverbal social cues, communication, absent or bizarre use of speech, social interaction. There is problem with verbal and nonverbal communication. Patient has difficulty to interfere with others. Behavioral symptoms like odd preoccupation with repetitive activity, bizarre mannerism, rigid adherence to purposeless ritual, a ritual without goal, is to describe a repetitive attitude. A normal kid cries when mother leaves the room. Autistic patients don't. There is mental retardation in 75% of autistic disorder. Physical findings like high incidence of abnormal electroencephalogram and abnormal brain morphology and seizure. Of course, 30% of autistic become semi-independent in adulthood, but with some residual disability. Prediction of poor outcome like mental retardation and failure to develop itself speech. Physical examination include self-injury caused by head banging or biting. Treatment is mainly family counseling, a special team for education, and there is a new psychotic medication to control severe agitation and self-destruction. Differential include mental retardation, hearing impairment, environmental deprivation, and selective mutism. The second chapter is about Asperger syndrome. What is Asperger syndrome? The syndrome belongs to autistic spectrum disorder, ASD, but Asperger differ from ASD by a relatively unimpaired language and intelligence. Many questions and controversies about the condition remain. There is doubt about whether it is distinct from high-functioning autism. High-functioning autism, a person with a relatively mild symptom, which, despite their mildness, are significant enough to merit an autism spectrum diagnosis. What is high-functioning autism? It is an autism classification where the patient exhibits no intellectual disability, but may exhibit deficit in communication, emotion, and social interaction. If we make some parallel between autism and Asperger, autism often low to mild intellectual quotient, physical development delay, and mental development delay. Asperger mild to very high intellectual quotient, physical development delay is rare, and mental development delay is also rare. What they have in common? Little eye contact, little response to others, and inappropriate response. How to distinguish autism from a normal child? For a normal child, he has a normal language. On the other hand, autism have abnormal language. Normal seek out for others. Autism avoid others. Normal child has eye contact. Autism, there is minimal eye contact. Normal child cries when mother leaves the room. Autism doesn't. Normal child seek nurturing. Autism avoid nurturing. Normal child play with others. Autism may be aggressive toward others. Normal child seek pleasure and avoid pain. Autism avoid pleasure and may injure himself. Autism think about verbal difficulty. Same repetitive gesture. If mother is outside, he doesn't cry. And there is difficulty with to socialize with others. Thank you for watching this episode of Medicine in 3 minutes. Would you like to click the button like and subscribe? Your comments are very welcome. Thank you.